Welcome to Why the Long Face? Two old friends lifting the lid on mental health over a beer with author and psychiatrist Paul Keedwell and business consultant and so-called comedian Ollie Turnbull.
Right, okay. I've got a bottle this week, actually.
Oh, passing.
Okay.
Oh, jeez. Right, what have you got?
The beer of the week is Shipyard American IPA.
Nice. Mine's a Hop House 13 Lager by Arthur Guinness. So it's Irish. It's a massive 660 millilitres.
Well known for their lager. Well, it's got a lovely blend of American hops, including Cascade. Excellent.
Oh, excellent. Mine's 5% by volume, 650 millilitres of the finest lager from St James's Gate in Dublin. I don't talk like that in Dublin. It's more Bob Geldof, isn't it? Dublin, but anyway. More like Dublin, isn't it? More like St James's Gate, Dublin. That's not bad.
Wasn't bad.
Yeah. Right, cheers, mate.
Cheers.
Jeez, that's really nice.
That's tasty.
Yeah, it's got a little kick to it. It's got a real kick to it.
It's going to be hard to pace myself tonight, I think.
Congratulations, Arthur Guinness. You've done it again. Right. So, the subject of, now that we've wet our whistles, is welcome, by the way, to Why the Long Face. We should have said that, shouldn't we?
We should, yeah.
Hello, welcome to Why the Long Face. Yeah. And this week we're talking about what is depression.
What is depression, exactly?
So the whole series of podcasts is about depression, but we thought episode 2...
Well, it ain't sadness, is it? Even though my book was called How Sadness Survived, but that was for poetic purposes.
You've done it. You've broken your record. Within 60 seconds, you've mentioned your book. You had a book?
Which is now 10 years. I'm not trying to flog it anymore.
You're not trying to
I don't care anymore.
No,
they pulped it long ago.
That's right.
But,
said no author ever. right.
Yeah, you believe that, you believe anything. Yeah, it's still on sale, I think, Amazon, all good bookstores.
That's the book you don't want to sell. I have to say, I've got a dedication.
Not many bookstores have it.
No, it's not a great. It's not a great floor filler, is it? It's not people walking across the window.
Well, at one time, anyway.
Nigella's latest. Oh, and look.
Anyway, only I can be rude about my book. Otherwise, I get upset.
Yeah, sorry, mate.
That's all right. I'm joking. So, How Sadness Survived. Yeah, so that was what it was called. But depression isn't sadness, obviously.
It's an interesting point. I bet there's still quite a lot of people out there who think it's just super sadness, if you like, being really sad.
Yeah, just being a little bit more sad than normal.
Yeah.
And just why don't you snap out of it? Because normally if you're sad, what do? Maybe go and see your friends or go and watch a movie or something.
That's right. The classic thing is, why don't you come out and go and see Bob?
You need to snap.
Bob always cheers you up, doesn't he?
Yeah.
But I think something that you've told me before about something that categorises it is the fact that things that used to give you pleasure no longer give you
because I think,
pleasure.
yes, that's right. I think that's the key, because a lot of the time, people who are depressed don't report sadness. They just they might report emptiness,
an absence of anything,
and particularly blokes can be bad at being in touch with that emotional side anyway. And there are big cultural differences. So in America, more people would respond to a questionnaire that says, the question, are you feeling sad? Some of the time, most of the time, all of the time. And of course, with depression, most people do feel sad most of the time, okay? But there are some cultures in Africa where depression is sort of an illness of thought. So I can't stop thinking, I can't stop turning things over.
That is
so
interesting.
It's not an illness of sadness necessarily. It's not. So it's maybe one of those examples where thought patterns follow the words you use, but certainly.
That is absolutely fascinating. Do you think that is part of the Western obsession, you could call it, with happiness?
Yes.
And the pursuit of happiness.
I do.
And if I'm not in a happy space, I'm sad, and that's my problem.
Yeah.
I don't know how that maps onto the African experience, but...
I mean, there are cultural differences also in how the body responds to being depressed. So I think classically North American, Western European concepts of sadness are to do with broken heart or something to do with they feel it in the chest, and maybe that's because historically depression comes from the term cardiac depression. It was used as an analogy for heart failure. So heart failure used to be called cardiac depression.
Good Lord.
And then then there was mental depression. So it's odd, isn't it? But we have got this. I think we feel anxiety in our hearts. We feel like that, the classic thumping chest. And I guess people who have a lot of anxiety associated with their depression, which is most people, they get palpitations sometimes, or not. But
what is that then? Because palpitations to me sound like a reaction, a bodily reaction to fear.
Yeah.
Is that the anxiety that's often associated with what we call depression?
Yeah, I think so. I've never known a case of depression. An individual with depression doesn't have a ton of anxiety.
I love the way you say, I've never known a case. It sounds like
Sorry.
you're a very venerable old doctor. No, it's absolutely brilliant because you are a venerable old doctor. I've never known a case. That's marvellous. Yeah, isn't it great? I wish I would be able to say, I've never known a case. In all my years, I've never known a case. Yeah. Sorry, you're saying that.
I mean, you can't. It's not very useful for diagnosing depression. Obviously, being anxious, because you could just have an anxiety disorder. But it is rare. I mean, I can't. As I say,
in all your years,
they are bedfellows. But
comorbid, I think is the
yeah. But it's not specific enough. So, but whereas anhedonia, or this lack of pleasure and lack of pleasure, I think
we talked about this last time. Yes.
Right, is I think pathognomonic of depression. But ICD-10, the International Classification of Diseases 10, they haven't brought out 11 yet, but they will soon.
It's going to get automatically downloaded like Windows 10.
DSM-4 and now 5. They all agree.
Just ignore the gag.
What?
I just said, will it get automatically downloaded like Windows 10 does?
So you do it's overnight option. Suppose you put a pin in.
Sorry for putting you off.
That's all right.
That is what the definition
the core symptoms. There are 3 core symptoms.
Right.
2, right? And you have to have 2 out of 3. So it's the sadness, the pervasive sadness, which you've already said it isn't always, people don't always recognise.
And subjective and culturally.
And culturally a bit kind of questionable, right? Or variable. And then you've got anhedonia, and then you've got lack of energy.
And it boils down to that in the definition.
Yeah, so 2 out of 3 gets around the problem of sadness not being necessarily a universal symptom.
That is absolutely fascinating. So does that mean...
for 2 weeks or more.
For 2 weeks or more. So there's got to be a chronic nature.
It's got to be most days as well. You can't
most days.
Just have a day a week where you feel.
I've never heard anything so elegantly described. I mean, I'm sure it's not 100% foolproof, but it's quite an elegant description.
It's quite tried and tested now.
Is it?
You know, but then of course you go on to ask about all the other symptoms that go with depression that help to give you an indication of severity of the depression, I guess. And also just give you a bit more confidence that you've got the diagnosis right. Because in some instances, you're dealing with people that have got physical health problems that can cause problems with lack of energy, for example.
Yes.
Right? So they might start to lose a bit of specificity. So there are specific questionnaires that people can complete if they've got lots of physical health problems that might affect things like concentration and energy that are also affected by depression.
Does that make it quite a little bit easier to diagnose a fit, young, healthy person who, for quotes, no reason at all, suddenly doesn't enjoy playing football, feels that they're not diabetic and yet they're exhausted all the time, and they have a sadness that they can't put their finger on, without any sort of physical ailments as well? Is that an easier diagnosis potentially?
Yeah, you've got lots of different questionnaires that can be used and things that can help help family doctors. They often use the PHQ, which is the patient health, just called patient health questionnaire, I think. And a score of over 5 indicates probable depression. I quite like the Beck Depression Inventory. That's a 21-item questionnaire. That's just gives you a little bit more information, really.
More granular.
More granular, more to work with, I guess.
Do you ever worry that this is a human brain and a person you're dealing with? You can't sort of break it down to a set of stark questions like that. You've got to use your instinct, your experience over your many years, and also how well you know the patient as well, presumably comes into it.
I think experience does come into it. I think quite often I can tell a depressed person walking into the room before I even ask them any questions.
Bloody hell.
Well, just because there are so many features of what we call the mental
And
state
you also are a
examination.
psychiatrist.
Yeah.
So, which is-
Well, you'd hope I'd have a bit of a feel for it. But actually, the best way to diagnose is going to be a combination of question, history and examination, just like any disorder, actually.
Or any scientific observation, you might say, I guess.
Maybe. So the questionnaire obviously is teasing out all sorts of dark thoughts that people might be hiding. So some people are an expert at masking their depression. Generally speaking, though.
Are these people who've had it for a long time?
Yes, stalwarts, people who've learnt to act.
Well, we'll come back to my colleague at work, Tom,
Oh,
later.
yes,
But
Tom.
again,
Yes.
he was, Tom, I'm very interested in him because that's not his real name, by the way.
Okay.
He was one of those Tom, of all the people, who would expect him to suffer from that? And I suppose it's a lifelong thing with him, or at least since he was a very young child, and we'll do childhood depression in another ep. And so he's an expert, an absolute expert, Oscar-winning actor in, and to see the mask drop. I mean, you've had this privilege for years. To see the mask drop
In an unguarded moment.
is actually quite a privilege, and
Because it's exhausting to act, isn't it? It's exhausting to pretend, but presumably Tom is quite socially skilled. You know, I think if you and one of those high, reasonably, anyway.
He's certainly high functioning. He's very intelligent.
Right.
I think he lacks some degree of emotional awareness, but
Okay, right.
But yes, he's a high functioning individual. He's charming, very interesting, and
Okay, good. Well, yeah, I mean, because I think when people let the mask slip, what I will see walking in the room is someone who's lacking animation. Well, sometimes they can be agitated, but on the whole, if I see someone sloping into the room, a bit hunched, not very good eye contact, downcast, meaning the eyes cast downwards, I'd be thinking, I have a high suspicion.
I think I could do your job actually.
It is pretty straightforward.
Yeah.
I suppose it's less straightforward when people have a very agitated depression, where the anxiety is very intense and they can't keep still.
Do you you talk about comorbidity a lot between anxiety and depression? Do you treat them as different maladies, or do you see it as a spectrum or a Venn diagram?
I see it more as a triangle, actually.
Right. What was a trapezoid? I see a dodecahedron.
It's not any kind of polygon. It's that's just overcomplicated math. No, it's a I see it as a hierarchy with. So if you treat depression, the anxiety takes care of itself. So anxiety is lower down the hierarchy than the depression. Right?
Really?
Whereas someone who's depressed could be depressed because they think the Martians are after them. Okay, I'm using a crass example, but they might have a psychotic illness, which is depressing the hell out of them. And above psychosis is organic. So they might have a thyroid issue, Cushing's disease.
Do you mean physiological?
Like some kind of hormonal problem,
right.
or even they're coming down off drugs. That would count as organic.
Oh, I see.
Right, so it's not functional. It's not sort of stress related.
Oh, I see.
So we give that person thyroid hormone, or sort out their adrenal glands, or whatever it is. I mean, these are rarer causes of depression, but everything below it will probably sort itself out. Temporal lobe epilepsy can mimic schizophrenia.
So sorry, go through the triangle again. What's at the base?
At the base is anxiety disorders.
Above that?
Mood disorders. So depression, or depression and or bipolar disorder, non-psychotic. Then above that would be psychotic disorders, like schizophrenia. You can have psychotic depression, you can have psychotic mania.
Yeah. And so, is this your triangle, by the way?
Well, I didn't invent the hierarchy, but I've put the hierarchy in a triangle.
Well,
so I can paste it.
That's what I mean. The triangle is yours. So that's really, I like the crisp definition. We've obviously got to we realise it's a sort of scale. In terms of severity, I'm always sort of cautious to try and think about that. I mean, presumably there is severity. Obviously, there's people who can't function at all. And I think you talked about last time the point at which the depression affects your life is the point at which you start to think about a clinical diagnosis.
We talked about questionnaires, but actually interviewing people is the best way to find out about that, isn't it? You know, so asking people directly, or asking friends and colleagues or partners. Usually, when patients have come to see me, they're not able to work anymore. But in the milder versions of depression, or earlier stages perhaps of an illness, they'll be struggling on and still working. Maybe they'll go and see their doctor. A lot of people don't know that they can go see their GP about depression.
Ah, really? It's not proper illness.
Because that idea that it's not a health issue. I think when people get to see their GP, they're probably at a point where they are really struggling with work and might need an adjustment in their working hours. But it affects functioning across the board, so they won't be functioning as well at home either.
Well, one question I've always thought of, you see a snapshot of this patient at a particular time. Often it's the same time every week, I'd imagine. How do you compensate for the fact that you're just seeing that snapshot and you're not seeing their condition throughout the whole week? They might be putting on a brave face for you. Maybe the opposite. Going to see the psychiatrist reminds them that they're ill.
Well, you're well, the first thing you do is you ask about how they are today, but then you'll ask them about how long you've been feeling like this, and then you'll ask them about lots of other things to do with the history of these symptoms. When did this symptom come on? When did that come on? Okay, can you think of any triggers for it? And so on. And then you might ask as well, you should ask about whether they've had depression before, and also whether they've had any highs, because a lot of people come along with depression who are actually bipolar, but at the time you see them, they're depressed, so you don't know that they might be on that spectrum.
Exactly. So this
a lot of
thing,
bipolar spectrum is missed.
Because the other thing we used to talk about, certainly when I was growing up, I remember a breakdown. They've had a nervous breakdown. They've had a mental breakdown. I know that doesn't exist from what I've read in sort of medical in the DC. What is it? The DC-10.
Well, you mean the nervous system doesn't just completely self-destruct?
That's right. Your head just goes.
Hold on. Yeah.
What's happened? You said a mental break.
And my central nervous system is just a bit broken.
Yeah, it just broke down.
It just I was standing there one day, and then suddenly it went
twang.
There's this big crack all the way down the back of my spine,
Blue
from
spark.
my head all the way down.
From my ears. I had a nervous breakdown. Or it's just. And that, to me, again, as a child, I was quite scared about that. Because
it sounds irreversible as well.
It sounds irreversible. It sounds like a terrible shock. It sounds like it comes out of nowhere, and suddenly you've broken down. And I don't actually think...
Can't just... Yeah, and it doesn't sound like you can just call the AA, right?
No. Oh, you have a special AA, don't you? You have the
big men in the big white coats.
I've had a breakdown at your service.
Slam the doors behind them.
So they'll be here in 45 minutes. Please stay by your nervous system until the mental police arrive. It's terrible, isn't it? But it's funny that I saw Keira Knightley suffered from what she called a mental breakdown in the press.
Oh.
And to me, I read it because I thought that sounds awful.
She had a trauma, didn't she?
Well, I think she got a lot of criticism. She got a lot of hate.
Was that recently when she came out and said?
No, it was post.
Because recently she said she's had PTSD following some kind of.
Yeah, that was it. So it's been.
Right.
That's right. PTSD, and that's exactly and
post-traumatic stress
quote
disorder.
Absolutely, and quote a mental breakdown. And she attributed to bad reviews and sort of personal attacks following Love Actually and other films where. A lot of people just went, God, I don't understand why this girl, blah, blah, blah. And
I always understood, because she's beautiful.
Well, yes, you understood. No, Keira Knightley's lovely. I've seen her once, and she was very good, and she's very beautiful. And it's a.
Well, I tell you, she was young when she made a lot of those.
Well, that's my point. She's a young girl. She's
her
like
writing register and range improved.
You're overrated. You're overrated.
Right.
And you're a bit
well, she was. I think she was a bit wooden then, but maybe she would agree with me. I don't know.
I don't know. I've never been battered in Twitter. It must be horrible, particularly for you, young girl.
True.
And anyway, my point
actually, we should do a whole episode on facts and figures around trolling and Facebook.
Oh, that's lovely.
I mean,
like it.
It's horrendous.
So we've talked about tests. We talked about severity, and we talked a little bit about bipolar.
Well, we didn't talk about severity actually much.
Okay.
Because severity...
There's more to say.
Well, I think... Oh, yeah, because we talked about functioning, but a part of that is also finding about other symptoms. So sleep, appetite, changes in appetite, changes in libido. So in more severe cases of depression, you will have much more disturbed sleep pattern. And early morning awakening being classic one. So people...
That sounds tortuous.
Yeah, so waking at sort of 3 or 4 in the morning, not being able to get back to sleep, I think, but also middle insomnia, which is just so people. Yeah, but I think the key thing with depression is that sleep is not as refreshing, even if perhaps you're getting 8 hours sleep.
God,
you're not feeling rested when you wake up.
That sounds horrible. It sounds like you can't escape from this thing.
And appetite change, although you can have and in fact you can have hypersomnia, which is sleeping more than usual, but that sleep is not
refreshing.
It's not effective. And then changes in appetite. People can be off their food a bit, or they can lose a significant amount of weight in more severe depression. So
Can they overeat?
overeating is also reported, although I find that that's less common in severe depression. So severe depression is mostly weight loss.
I assume, therefore, if you've got no energy, you're not getting any pleasure, and you're anxious, the very last thing that you want to do
Can't be
is
asked to
tuck
cook.
into fish and chips, and you can't be asked to cook. Yeah.
So there'll be a lack of drive, but together with that, there will be a genuine lack of appetite, which is strange, but it happens.
Doesn't sound very nice, I have to say.
And then, more severe still, you can get psychotic symptoms.
Aha.
Symptoms that are outside of the normal range of human experience.
Does it mean sort of losing touch with reality, imagining things,
Yes.
hallucinating,
Yes.
hearing things, seeing
And
things?
classically, those hallucinations.
By the way, this voice is keeping telling you you're useless.
Yeah, they're actually correct, are they?
No, that's me. It's me. So, what you said before to me was if you treat the thing below, the other thing takes care of itself.
Not in that case,
So you're not saying that, say, a depressed person with psychotic symptoms, you gave them antidepressants, depression went away. That doesn't necessarily mean psychosis.
Well, there'll be a little transition, maybe giving someone antidepressants and an antipsychotic. It is a bit complicated. The way you determine how you treat someone in these sort of situations is what came first, the depression or the psychosis,
okay.
right?
I'm with you
So,
now. Yeah.
if the story is you started off with a classic depressive type illness, and then that deepened and deepened over time because you didn't get help quickly enough, which a lot of people do, and it's not their fault. Maybe they don't have anyone to walk them through it and say, look, you're depressed and get some help. Then they develop psychotic symptoms, which are classically mood congruent. So the voices you hear will be, as you said, you're useless, they'll be critical, they'll tend to be in the second person like that. You are this, you're that, you're bad, you may as well kill yourself. That's the other severity sign, by the way.
Is it
Suicidal
a voice that
thoughts.
you know, or is it an unknown voice? That's what's always kind of freaked me
It's
out.
usually unknown.
God, that's how the brain can concoct its own character that doesn't exist. It's terrifying.
Yeah, it's usually unknown. And then delusions can develop around or secondary to those mood congruent voices, where you start to think people have got it in for you. And
makes
then
some kind of sense.
there's one step from there to thinking, this is a conspiracy, and the neighbours are trying to poison me or whatever. And then beyond that, even more severely depressed, would be punishment feelings. Pathological guilt. I'm responsible for all the problems in the world, and I deserve to be punished. I deserve to be poisoned, but we're getting to quite a. And then classically elderly depressives, they sometimes get Cotard syndrome, which is this thing where they are convinced that they're dead already, or parts of their body are dead.
But so, is that a depressive?
So that is a classic depressive psychosis. Yes. Whereas if someone just started to hear voices.
Got it. That does make sense. Your triangle is
without depression,
the
the psychotic illness developed and became more florid, and then people became genuinely terrified that they're being persecuted. Is the most common scenario, paranoid schizophrenia. Then, if you sorted out the schizophrenia with an antipsychotic medication, then the depression would usually go too.
Wow.
And the anxiety, of course, because the anxiety is secondary to all those delusions.
Which makes a hell of a lot of sense. Yeah. No,
so the triangle works, man.
Yeah, no, the triangle is
and if you had temporal lobe epilepsy that was causing you to have hear voices, then you would treat the epilepsy. You wouldn't treat someone with antipsychotic.
For the record, he's brandishing the bottle and poking it in my direction with every syllable of temporal lobe epilepsy.
We have attempted to, I guess, to sum up what depression is, how it presents in different ways in different cultures, but it's basically the same animal wherever you go. Depression is an illness that is characterised by lack of energy, lack of pleasure in things you used to enjoy, and maybe sadness, but not always.
Nice.
Hey, thanks for joining us on Why the Long Face. As ever, we're here to inform, hopefully, and entertain, but we're not here to give you medical advice. There is, however, information on our website about where to get help. See you next time.